Hello, my name's Joyce Gibb. Thanks so much for being with us today. Today I wanted to review injuries that can happen in the summertime. And the first one are bee stings. It's very common to have stings in the summer. You can have bee stings from hornets, wasps, any kind of stings that cause pain. And so bee stings typically they cause a localized reaction with redness. And of course, it's very painful. If you have a bee sting, you should take the little stinger out if you can with some, tweezers, etc. And, that injury starts locally, very small, and you can have a big injury, a big swelling. Like some people are very allergic to bees and they get stung on their hand and it can go all the way up to their shoulder. So as long as you don't have trouble breathing, lip swelling, things like that, you don't really have to seek medical attention. A lot of people go to the ER and urgent cares for this, though, because it's significant. The best thing you can do is use Benadryl. So Benadryl is an antihistamine, and with kids, the dose is according to their weight, and there are 25 milligram tablets that you can take for adults. So you can take that every 6 hours for Benadryl. If you have a severe allergy to bees, then you should always have an EpiPen. No matter where you go, keep it in your car, keep it in your golf bag, whatever, because, anaphylaxis can happen where your airway closes shut. So Benadryl is a treatment for that. You should have Benadryl. All moms should carry Benadryl in their purses because if you have a severe reaction, you don't want to wait for treatment. So, sometimes when they do the EpiPen, epinephrine is a vasoconstrictor. And so that can make you throw up. So that's very common for kids to throw up after they have an EpiPen. They usually put it in the top of their leg. So you should remove the stinger. So bee stings is the first one. The second one is chiggers. I don't know if you've ever heard of chiggers, but they potentially live in high grasses. They're small mites that live in weeds or tall grass. They do not hurt. They do itch. That's the big thing. Several days, they remain attached to your skin, and before they fall off, when they fall off, they have the red mark, and so that's what causes the red mark and it attaches to hair too. So if people have hairy legs, then it attacks, especially with guys. So after they fall off, they leave these red welts on the skin that itches. You can use over-the-counter steroid cream or oral antihistamines, and when I was little, my mom used to put clear fingernail polish on the red dots, and that seemed to help. It seemed like it suffocated if there were any mites left there. So it's not anything serious, but they can be very, very itchy. The next one are venomous snakes. So it's very scary when you see snakes that are venomous, the rattlesnake, the water moccasin, copperheads. And if you get bit by any of those, you should seek medical attention right away. You don't know what kind of snake it is, whoever's with you, or if you can look at the markings to try to see what kind of snake it was. That's because they'll want to know what kind of snake it is, because certain ERs have to get the antidote for the venom, from a poison control center, etc. So a lot of ERs, if they have those venomous snakes in the area, they typically carry it, but they might have to get it from other places. So just have someone verify with you what kind of snake potentially you think that would be. And the last thing I want to talk about today are ticks. This is the hiking season. Ticks do not die in the winter. And in the Northeast, of course, the ticks are in higher amounts. I had somebody tell me when I was working in an urgent care one time, he was in New York and he worked for the oil and gas industry. He was up on the top of a mountain in New York and he came off the mountain, and some guys that saw him when he came off, he had hundreds of ticks all over him. He was freaking out. He stripped down from his clothes. They were all in his hair. He, took his clothes off, went home, of course, threw those away. And, but, ticks can, they're around every place. So if you see one, you should try to remove it, the full tick from not just the head. The head remains, you don't dig it out, but you should go seek medical care to have that looked at. But try to save the tick if it comes out whole. My mom used to put a lighter behind the buttocks of the end of the tick to get the tick to back out. or they would use lighter fluid. Well, that's not recommended, all those things. But, you have to figure out how long it has been in there if you have any knowledge. Sometimes those ticks are so small, they look like a speck of dirt. But you should remove the tick and go ahead and save that in a plastic bag. So there's a couple websites that you can send the tick to after removal. It's www.tickcheck.com. You get the results in 48 hours if you want to determine if it was a deer tick, if it's an infectious tick. And the basic fee for that is $49.99. It shows the top pathogens, which are 6 pathogens that can happen from ticks. The advanced panel is more expensive, and they show the 8 to 9 pathogens. There's another one, is called Tick Report. It gives the species back in 72 hours, and it's $50. So the big thing to remember is tell your provider how long you've had the tick on you, if you can estimate. If it's engorged, of course, with blood, it's been on there a lot longer. If the other thing is, too, that a tick bite can cause disease. It can cause mental brain fog. You can have joint pains. There's several symptoms that you can have from a tick bite, and it doesn't happen right away. So to get the red bullseye is not always there with tick bites. So just make sure that you get treated. They typically treat with doxycycline. Depends on, some people give it a 2-day course if you don't know how long it's been there, or you think it might just be a day or two. Some people, if you have a tick bite and you get the bullseye, they a lot of times do doxycycline for a whole month. So get the tick checked if you can, and then you'll know if it's really worth that you have to treat all this. I mean, I have been treating tick-borne illnesses, so that is something I can do. I can help you with that and on your journey to good health. So give me a call. Thanks a lot, and have a good day. Thanks for listening. If you want to make sure you're getting the latest health information, click the subscribe button below and ring the bell. That way you can make sure you're not going to miss out on any of the latest information.